So I think there's a couple of areas that are looking particularly interesting in small cell. First of all, we have two positive randomized controlled trials now. One with a drug called Atezolizumab, one with a drug called Durvalumab. Identical results, giving a 2%, giving about a 2-month median survival benefit at different time points. And I think that's a real benefit to patients with small cell. We haven't seen major advances being made before. And the key is actually giving the antibody with the chemo. If you give it sequentially, it doesn't seem to work, but it seems to work if you give it concurrently, certainly from cycle 2 onwards. So I think that's a very nice, the first little tick box we've had in small cell for a very long time. The second issue that's been raised and has been brought up at this meeting is the potential for developmental research defining it as a stepwise progress, in that we know potentially PARP inhibitors have activity in small cell. And PARP inhibition basically leads to increased genomic instability. And when you get increased genomic instability, you can get increased neoantigen formation. And if you get increasing neoantigen formation, you might enhance the activity of the immune checkpoint therapies. So there are trials where you get combinations of PARP inhibitors with checkpoint inhibitors. And I think that's an interesting space that could yield very interesting data. So I'd be quite optimistic that might be another little step forward, So yeah, I think for small cell we're seeing at last some light at the end of the tunnel. Now we've been involved in a trial called the Stimuli trial, which was recently discontinued, but there are enough patients recruited to that trial already for us to see if giving concurrent immunotherapy giving immunotherapy with our chemoradiation, if giving that afterwards as a maintenance strategy is going to actually prolong patients' lives. And certainly from our own little personal experience as being in that trial, I would be quietly optimistic that that's possibly going to be true, but we won't find out for a little while. But that's a very potentially, again, another exciting area. Unfortunately, it won't be a full phase 3 trial, but there's enough patients in the study when it matures, I think, to get certainly a strong pointer if we're moving in a very positive way.